Look at your gums right now, not later, not tonight, right now, because there's something most people never realize until it's already happening. I didn't notice it at first either. Why would I? There was no pain, no dramatic change, no moment that made me stop and think, something is wrong. Everything felt normal, routine, safe. But one day, I looked a little closer, and that's when it hit me. My gums didn't look the same. They weren't swollen or visibly infected, nothing extreme, just different. Slightly lower, a little less firm. The line that once framed my teeth perfectly now looked uneven, almost like it was slowly pulling away. It was subtle. So subtle that I could have ignored it again, but this time I didn't. And that's when a thought crossed my mind that I couldn't shake. What if this is how it starts? Because here's the uncomfortable truth. Tooth loss doesn't begin with a tooth falling out, it begins quietly, beneath the surface, in the gums, long before anything feels urgent, long before pain forces you to act. The early signs are easy to miss, or worse, easy to dismiss. Gums that look slightly receded, a change in color, a softer texture. Maybe a little bleeding when brushing, but nothing alarming enough to take seriously. And that's exactly why it progresses, because while you're living your normal life, thinking everything is fine, something is slowly changing. The support system of your teeth, your gums and underlying bone, can begin to weaken. And once that process advances, it becomes much harder to reverse. That realization carries weight, because it introduces a question no one likes to face. Have I missed the signs? And even deeper than that, is it already too late? That's where the fear starts to grow. Not loud, not chaotic, but quiet, persistent. Because your smile isn't just about appearance. It's part of how you express yourself, how you connect, how you show confidence without saying a word. And the idea that something might look off, something others could eventually notice, creates a subtle insecurity that's hard to ignore. You start thinking twice before smiling. You become aware of angles, lighting, distance. You wonder if anyone else can see what you're starting to see. And even if they don't, you do. That changes everything. I remember standing in that bathroom, staring at my reflection longer than usual. The mirror had become a different kind of space. Not just a functional tool for getting ready in the morning, but a diagnostic screen where I searched for evidence of something I couldn't quite name. My fingers traced the gum line, gently pressing against the tissue. It felt different than I remembered. Softer, maybe. Less resilient. Like the foundation beneath a building that had started to shift imperceptibly. And then came the questions that spiral in the quiet moments. How long has this been happening? Was it like this last month, last year? When did normal stop being normal? The truth is, gradual change is almost impossible to track in real time. We don't have baseline photographs of our gums from 5 years ago. We don't measure gum line height on a regular schedule. We just live and assume that what we see today is what we've always seen. Until suddenly, it isn't. That's when I started doing what everyone does. In moments of mounting concern, I researched. Late at night, after everyone else had gone to bed, I found myself scrolling through medical websites, dental forums, before and after photos that made my stomach tighten. The information was overwhelming. Clinical terms I'd never heard before. Gingivitis, periodontitis, gingival recession, bone resorption, pocket depth, clinical attachment loss. Each new term opened a door to more questions. And with each question, the scope of the problem became clearer and more frightening. Because what I discovered was this: the process I was witnessing wasn't just cosmetic, it was structural. Healthy gums don't just frame your teeth aesthetically, they seal and protect the underlying bone. They create a barrier against bacteria that, if left unchecked, can colonize the space between gum and tooth, forming pockets that deepen over time. And once those pockets reach a certain depth, the damage becomes exponential. Bacteria thrive in those protected spaces. They produce toxins that trigger chronic inflammation. That inflammation breaks down the connective tissue that holds gums to teeth. And as gums recede, they expose the tooth root, a surface that was never meant to be exposed, that's more vulnerable to decay, more sensitive to temperature, more prone to damage. The bone beneath follows the same trajectory. As inflammation persists, the bone that anchors your teeth begins to dissolve, not dramatically, not all at once, but millimeter by millimeter, creating an invisible crisis that only becomes obvious when teeth start to feel loose. By then, you're not in the early stages anymore, you're in damage control. Reading all of this at 2 a.m. was not comforting. In fact, it made everything worse. Because now I had language for my fear, I had medical explanations for what I was seeing, and I had timelines that suggested if I didn't act soon, the window of reversibility might close. But I also had something else: confusion. Because for every authoritative medical site explaining the progression of gum disease, there was a forum post from someone saying they'd reversed it naturally. For every dentist recommending immediate professional intervention, there was a blog post about oil pulling or herbal rinses or dietary changes that supposedly worked. Miracles? Who was right? What actually worked? And more importantly, what stage was I actually in? That uncertainty was almost worse than the problem itself, because I didn't know if I was overreacting to something minor or underreacting to something serious. I didn't know if what I was seeing was early-stage gingivitis that could be managed with better brushing technique, or advanced periodontitis that required surgical intervention, and I didn't know how to find out without committing to an expensive dental appointment that might tell me everything was fine, or that I'd waited too long. So I did what many people do in that position. I waited a little longer, not because I didn't care, but because I was paralyzed by uncertainty and the fear of confirmation. But waiting didn't make the anxiety go away. If anything, it intensified, because now I was hyper-aware. Every time I brushed my teeth, I looked for signs of bleeding. Every time I flossed, I examined the color and firmness of the tissue. Every time I ate something crunchy, I paid attention to how my teeth felt. And the more attention I paid, the more I noticed. Small things. Things I'd probably dismissed 100 times before but now carried weight. A slight sensitivity to cold drinks. A feeling that one tooth sat slightly differently than it used to. A spot along my gum line that looked darker, more inflamed than the rest. Were these new developments, or had they always been there and I was just noticing them now because I was looking? That's the psychological trap of health anxiety. Once you start looking for problems, you find them everywhere. And you can't tell which ones are real and which ones are magnified by your attention. Then came the moment that forced me to act. I was at a family gathering. Everyone was laughing, talking, taking photos. And in one of those photos, a candid shot someone posted later, I saw my smile, really saw it. And I didn't like what I saw. It wasn't dramatic. No one else probably noticed, but I could see the asymmetry. The way my gum line on one side seemed higher than the other. The way certain teeth looked slightly longer because the gums had receded. It was subtle enough that most people would scroll past without a second thought. But I couldn't, because I knew what I was looking at. I knew it wasn't just the angle or the lighting. I knew it was real. And that photograph became a timestamp, evidence that this wasn't just anxiety or hypochondria. This was a documented change in my appearance. something I couldn't dismiss or rationalize away. That's when I finally made the appointment. The decision came with its own set of emotions. Relief that I was finally taking action. Dread about what I might hear. Embarrassment that I'd let it get this far. Frustration that I didn't catch it earlier. The days leading up to the appointment were strange. Part of me wanted to go immediately, to get answers, to know where I stood. Another part of me wanted to cancel, to avoid the potential bad news, to stay in the limbo of not knowing just a little longer. But I went. The dental office felt different this time. Not because anything had changed about the space itself, but because I was walking in with knowledge, with concern, with specific questions. I wasn't there for a routine cleaning. I was there because something might be wrong. The hygienist was professional, thorough. She didn't rush. She measured pocket depths at multiple points around each tooth, noting the numbers in a way that meant something to her, but sounded like a foreign language to me. 4 millimeters here, 5 millimeters there, 3, 4, 6. I didn't know what those numbers meant, but I could tell from her expression that some of them weren't good. When the dentist came in, he examined the measurements, looked at my gums, asked questions about my brushing routine, my diet, whether I'd noticed any bleeding or sensitivity. And then he said something that hit harder than I expected. You have moderate periodontal disease. It's not severe yet, but it's progressed beyond simple gingivitis. We need to address this before it gets worse. Moderate periodontal disease. Those words sat heavy. Because moderate meant it wasn't the worst case scenario. But it also meant it was past the point where simple adjustments might be enough. It meant I had, in fact, missed the early signs, or ignored them, or dismissed them until they'd accumulated into something that required professional intervention. It meant I was right to be concerned, and it meant the window of easy reversal had already closed. But here's what he said next that changed my entire perspective. This is manageable. It's not too late, but it requires commitment, professional treatment combined with changes to your home care routine. If we act now, we can stabilize this and prevent further loss. Manageable. Not too late. Those words were everything, because they meant I hadn't crossed into irreversible territory. I hadn't lost my chance. The foundation was compromised, yes, but it could be reinforced. The treatment plan was more involved than I'd hoped, but less extreme than I'd feared. A deep cleaning procedure called scaling and root planing, essentially removing the hardened plaque and tartar from below the gum line and smoothing the tooth roots to help gums reattach. It wasn't fun. It required multiple appointments. It was uncomfortable, but it was doable. And more importantly, it was effective, but the treatment was only half of the equation. The other half, the part that would determine whether this stabilized or continued to progress, was what I did at home. Every single day, the dentist and hygienist spent significant time teaching me things I thought I already knew, but clearly didn't. How to brush properly, not harder, but smarter. Angling the brush toward the gum line at 45 degrees, using gentle circular motions instead of aggressive back and forth scrubbing. Spending 2 full minutes, not the rushed 30 seconds I'd been doing. How to floss correctly. Not just snapping it between teeth, but curving it around each tooth in a C shape and gently sliding it beneath the gum line. How to identify problem areas by paying attention to spots that bleed, not as a sign to avoid them, but as a sign they need more attention. These weren't complicated techniques, they weren't expensive tools. They were fundamental skills I should have learned decades ago, but somehow never did. The first week of implementing the new routine was humbling. My hands weren't used to the motions. The proper flossing technique felt awkward and time-consuming. Brushing for the full 2 minutes felt interminable, but I stuck with it. Because the alternative, watching my gums continue to recede, my teeth continue to loosen, my smile continue to change, was unacceptable. And something interesting started to happen. After about a week, the bleeding reduced noticeably. The inflammation that had made my gums look puffy and dark started to subside. The tissue began to look healthier, pinker, firmer. I wasn't imagining it. The change was real. And that created a feedback loop of motivation. Because now I could see that my actions were having an effect, that the time and effort I was putting in wasn't just theoretical prevention. It was producing visible improvement. By the second week, the routine stopped feeling like a chore. It became something different, a ritual of self-care, a tangible way of protecting something valuable. Those 4 minutes of brushing and flossing each day weren't just maintaining oral health, they were preserving my ability to eat comfortably, to speak clearly, to smile confidently. They were preventing future pain, future expense, future loss. When you frame it that way, 4 minutes seems like nothing. But here's what I wish someone had told me years earlier. The signs I eventually noticed, the receding gums, the inflammation, the changes in color and texture, didn't appear overnight. They were the cumulative result of thousands of imperfect brushing sessions. Thousands of times I'd rushed through my routine. Thousands of nights I'd skipped flossing because I was tired. None of those individual instances felt significant, but together, over years, they created conditions where bacteria could colonize, where inflammation could persist, where damage could accumulate. And the tragedy is that it was all preventable, not through superhuman effort, not through expensive products, but through basic, consistent technique that no one ever really taught me properly. That realization was both frustrating and empowering. Frustrating because it meant all of this could have been avoided, the anxiety, the expense, the treatment, the risk, all preventable with information I should have had from the beginning. But empowering, because it meant the solution was within my control. I didn't need a miracle cure. I didn't need cutting-edge technology. I just needed to understand what was actually happening and what actions would address it. And once I had that understanding, everything changed. The follow-up appointments over the next several months told the story. Pocket depths that had been at 5 and 6 millimeters were measuring at 3 and 4. Areas that had shown bone loss on X-rays were stable. The inflammation markers were down. The dentist used words like significant improvement and excellent progress. But the most meaningful feedback came from something simpler. I could look in the mirror without anxiety. I could smile in photos without analyzing my gum line. I could eat and drink without worrying about sensitivity or discomfort. The quiet fear that had been living in the background of my daily life had dissolved. Not because the problem disappeared entirely. Some of the recession was permanent. Some of the bone loss couldn't be regained without surgical intervention. I chose not to pursue. But because I had control, I understood what was happening. I knew what to do about it, and I could see that my actions were working. If you've had even a moment like that where you look at your gums and feel like something might not be right, there's something important you need to check. Deixamos no primeiro link na descrição guia prático para você acessar de forma rápida, clique e veja. Because understanding what you're seeing is the difference between guessing and knowing. As I kept digging, trying to make sense of what was happening, I realized something that most people never hear clearly. The problem is rarely a lack of care. It's a lack of clarity. We brush our teeth, we follow routines, we assume that consistency equals protection, but no one really explains what to look for, what those early signs actually mean. Gum recession, inflammation, subtle color changes, these aren't random, they're signals, and they're connected to causes that repeat every single day. Brushing too hard, using the wrong technique, ignoring the gum line where bacteria accumulate the most, letting plaque harden into tartar over time. None of these feel like major mistakes, but over months, years, they build. And then one day you look in the mirror and realize something has already begun. That's where another layer of tension comes in. Cost. Because deep down, many people delay action not because they don't care, but because they're afraid of what it might involve. Expensive treatments, complex procedures, the feeling of being overwhelmed before even understanding the problem. So they wait. And that waiting feeds the anxiety. Because uncertainty doesn't stay neutral. It grows. The longer you wait, the more the doubt compounds. What started as a small concern becomes a constant background worry. Every toothbrushing session becomes a diagnostic check. Every glance in the mirror becomes an assessment. And the worst part is that you're doing this alone. You're not trained to identify what's normal versus what's concerning. You're working with incomplete information, conflicting advice from internet sources, and a growing fear that you might be making things worse by waiting. But here's where everything can shift. The moment you stop guessing and start understanding. When I learned what those early signs actually meant, something changed. Not just in what I saw, but in how I responded. I realized that not all damage is immediate, not all progression is unstoppable. Many of these conditions develop slowly, and that means they can be slowed down, sometimes even stabilized, when you act with the right knowledge. Not force, not panic, just clarity. Because here's what I learned that changed everything. Your gums are designed to attach to your teeth at a specific level. When that attachment is healthy, it creates a seal that protects the underlying bone and tooth root from bacterial invasion. But when that seal is compromised through inflammation, through mechanical trauma from aggressive brushing, through bacterial colonization, the attachment begins to break down. The gum tissue doesn't just pull away, it loses its structural integrity. The fibers that connected it to the tooth surface are destroyed by inflammatory enzymes, and once those fibers are gone, the tissue can't simply reattach on its own. That's why gum recession is often permanent without surgical intervention. But, and this is crucial, recession that's already occurred doesn't have to continue. If you identify what's causing it and address those factors, you can stabilize the tissue at its current level. You can prevent further loss. You can maintain what you still have. And in many cases, even if the gum line doesn't return to its original position, reducing inflammation and improving tissue health makes the exposed areas less sensitive, less vulnerable, and healthier overall. That distinction between reversing and stabilizing, it was vital for me to understand because it changed my goal. I wasn't trying to turn back time and restore my gums to what they look like at age 20. That wasn't realistic, and chasing that goal would have led to disappointment. Instead, I was trying to stop the progression, to protect what remained, to create an environment where my gums could be as healthy as possible given their current state. And that was achievable. The biggest revelation came when I understood the role of bacteria. We tend to think of oral hygiene in terms of cleanliness. Fresh breath, white teeth, a pleasant feeling. But the real purpose is bacterial control. Your mouth is home to hundreds of species of bacteria. Most are harmless, some are even beneficial. But certain species, particularly anaerobic bacteria that thrive in low oxygen environments, are directly responsible for gum disease. These bacteria colonize the space between your gum and tooth, especially when plaque isn't regularly disrupted. They form biofilms, organized communities protected by a sticky matrix that makes them resistant to simple rinsing. And they produce toxins that trigger your immune system to respond with inflammation. That inflammation is your body trying to fight the infection. But when the bacterial presence is chronic, when you're not effectively removing the biofilms every day, the inflammation becomes chronic too. And chronic inflammation is what destroys gum tissue and bone. So the goal of daily oral hygiene isn't just to make your mouth feel clean. It's to mechanically disrupt those bacterial biofilms before they become established, before they produce enough toxins to trigger sustained inflammation, before they colonize deep enough to form protected pockets. That's why technique matters more than force. You're not trying to scrub your teeth into submission. You're trying to systematically remove bacterial accumulation from every surface, especially the vulnerable areas along the gum line and between teeth. And that requires precision, not pressure. Once I understood that, my entire approach changed. Brushing became less about speed and more about coverage. I started thinking in quadrants: upper right, upper left, lower right, lower left, and making sure each one got adequate attention. I paid special attention to the areas where gum meets tooth, angling my brush to clean just beneath the gum line where bacteria love to hide. I stopped rushing through flossing and started actually paying attention to what I was doing. Curving the floss around each tooth, sliding it gently beneath the gum line, feeling for areas where the gums bled. Those were the spots that needed the most attention. It wasn't glamorous, it wasn't fast, but it worked. And here's something that surprised me. As my gum health improved, other things improved too. My breath was better, not just fresh from brushing clean, but genuinely better throughout the day, because the bacteria that cause gum inflammation also produce volatile sulfur compounds, the source of bad breath. Reducing bacterial load meant reducing those compounds. My teeth felt cleaner longer. The filmy buildup that used to accumulate during the day was less noticeable. Because I was removing more plaque with each brushing session, there was less foundation for rapid reaccumulation. Even my overall sense of oral comfort improved. The low-grade sensitivity and mild irritation I'd been living with, so subtle I barely noticed it until it was gone, disappeared. These secondary benefits created additional motivation. Because now the effort wasn't just about preventing some distant future catastrophe, it was producing immediate, tangible quality of life improvements. And that made the routine sustainable. Because humans are much better at maintaining behaviors that provide immediate rewards than behaviors that only prevent distant problems. If you've been carrying that quiet fear, wondering if tooth loss may have already started without you realizing, you don't have to stay in that uncertainty. Existe método no comentário fixo para quem sente essa ansiedade e quer uma forma simples e clara de reconhecer os sinais de alerta e evitar que a situação piore. Because once you understand what to look for, everything becomes different. You stop seeing random details, and start seeing patterns. You stop reacting late and start acting early. And that's where control comes back. Not perfectly, not instantly, but realistically. The truth is, most people with gum disease have no idea they have it, because in its early and even moderate stages, it doesn't hurt. It doesn't create obvious symptoms that force you to seek help. It just slowly, quietly progresses. And by the time it becomes painful or obviously problematic, when teeth start to feel loose, when abscesses form, when eating becomes difficult, the disease is advanced. At that point, treatment is more complex, more expensive, and less likely to fully restore function. But catching it early, even if early is after some damage has already occurred, dramatically changes the outcome. Early intervention means simpler treatment. It means more tissue can be saved. It means better long-term prognosis. It means the difference between minor adjustments and major reconstruction. That's why awareness matters so much, not paranoid, anxiety-driven hypervigilance, but informed attention, knowing what healthy gums look like: pale pink, firm, with a stippled texture like orange peel, forming tight triangular points between teeth, not bleeding with normal brushing or flossing, Knowing what warning signs look like, gums that are red, swollen, or shiny, gums that bleed easily, gums that have pulled away from teeth, making them look longer, changes in how teeth fit together when you bite. These aren't subtle differences requiring professional training to identify. They're visible changes that anyone can learn to recognize, but only if they know what to look for. And here's the most important part. If you see those signs, act. Don't wait for pain. Don't wait for it to get worse. Don't convince yourself it's probably nothing, because the window of easy intervention is narrow, and it closes quietly. Every month you wait is another month of bacterial colonization, another month of inflammatory bone loss, another month of attachment destruction. And all of that is happening beneath the surface where you can't see it. The visible changes, like the receding gum line, the color change, are just the tip of what's occurring below. Right now, in this moment, you have something powerful, awareness, and that alone can change the direction of what happens next, because catching it early, even now, can be the difference between losing control and preserving not just your teeth, but your confidence, your expression, your quality of life. Because the truth is, your gums are always communicating with you. The question is, are you seeing what they're trying to show? They're telling you whether your brushing technique is working or causing damage. They're showing you where bacteria are colonizing. They're signaling inflammation through color changes and bleeding. All of that information is there. You just need to know how to read it. And once you learn that language, you become an active participant in your oral health instead of a passive recipient of whatever happens. You stop hoping everything is fine and start knowing whether it's fine. You stop reacting to crises and start preventing them. That shift from passive to active, from reactive to preventive, is transformative because it applies to so much more than just your gums. It's a mindset, a way of engaging with your health and your body that honors both its resilience and its need for consistent care. If this made you look at your gums differently, subscribe to the channel because there are things hiding in your daily routine that no one ever explained clearly. And once you start seeing them, you don't just protect your smile, you protect a part of who you are, your ability to eat the foods you love, to speak clearly, to laugh without self-consciousness, to age without unnecessary loss. All of that is connected to what's happening in your mouth right now. And the beautiful thing is, you have more control over that than you probably realized. It doesn't require perfection. It doesn't require expensive interventions or dramatic lifestyle changes. It just requires understanding what matters, implementing basic techniques correctly and being consistent. That's it. But that consistency maintained over months and years is the difference between keeping your teeth for life and losing them prematurely. Between aging with a healthy, functional smile and aging with regret about what you could have prevented. The choice is yours. And it starts with a simple action. Look at your gums. Really look. And if you see something that doesn't look quite right, don't ignore it. Because that small concern you have right now, that's your opportunity. Your window to act while intervention is still simple, while damage is still minimal, while the outcome is still in your control. Don't let that window close.